Hi, my name is Xiaoying Zhu and I work at SUNY College of Optometry. I'm a clinician scientist and my research interests are visual development and myopia or nearsightedness. Myopia is a major public health concern right now because its prevalence has increased rapidly across the world in the last several decades, especially in East Asian populations. In China and Singapore, for example, about 70% of children graduating high school are myopic. The prevalence in the US has about 12 to 17 years of age. The prevalence of myopia was 12% in the 1970s and has gone up to more than 31% in the 21st century. So it has more than doubled in just about 30 years. It has been speculated that by 2050, in another 30 years, about half of the world population, about 5 billion people, will become myopic. So it's really important that we do something to stop the trend right now. There's a common misconception that myopia is just an optical thing, a nuisance to deal with, since myopia can be corrected with glasses, contact lenses, and refractive surgery. But myopia can actually cause complications in the eye that can cause irreversible vision loss. So myopia can cause glaucoma, for example, or retinal detachment, which means the innermost layer of our eye is detached from the tissues underneath, and also maculopathy, which is the disease of our macula, which is where we have the best vision possible. So, and some of these complications are they can lead to irreversible vision loss, and they cannot be corrected by optical means. As a matter of fact, myopia is considered to be the leading cause of vision loss in Asia. And the WHO recognized myopia as a significant cause of visual impairment if not fully corrected. While we're not exactly sure why these complications occur, we think that it's caused by the excessive elongation of the eyeball and reduced blood supply to the back of the eye. The global productivity losses in 2015 associated with visual impairment caused by uncorrected myopia and myopia-related complications were estimated to be $250 billion. Visual impairment caused by myopia has also a negative impact on the patients and their families, such as lost educational and vocational opportunities, and also lost economic gains, not to the families, but also to the societies. Therefore, myopia is really a major public health issue that poses tremendous economic burden. As I mentioned before, myopia is caused by the elongation of the eyeball. So it would be important to study how eye growth is regulated. Previous studies have shown that eye growth is controlled by the visual input, what the eye sees. So I have been investigating the molecular pathways that are involved in eye growth regulation and how the visual input is integrated at the retina to find potential ways to reduce the onset of progression of myopia in school-age children. Right now, I'm conducting multiple clinical trials to look at the effect of multifocal contact lenses on myopia control. Multifocal contact lenses is one of the main treatment modalities for myopia control, and the way it works is that there's a reading prescription embedded in the contact lens, and this reading prescription is considered to produce this plastifocus in front of the retina to act as a stop signal. So the patient would be corrected at distance so they can see clearly far away, but the reading prescription in their sight vision will act to stop eye growth. And multifocal contact lenses have been shown to be effective in slowing down myopia progression, but with variable efficacy. And one of the reasons is that maybe when children wear multifocal contact lenses during reading, they reduce the accommodation. So then the reading prescription is not really generating as much plastifocus to slow down myopia progression. So what I'm doing is I'm taking this theory one step further. So I measure children's accommodation over time to see if there's any correlation between the amount of myopia progression, the amount the eyes have elongated, and the accommodation. And this clinical study would have significant clinical impact. It will help us increase the efficacy of multifocal contact lenses for myopia control in school-age children.